Bismillahirrahmanirrahim. Assalamu alaikum. So today we are going to study about the one of the most important topic in the cardiac pathology, and it is called is the myocardial infarction, or in a layman language it is also known as the heart attack. So what is the definition of myocardial infarction or heart attack? It can be defined as the necrosis of the heart muscle resulting from the ischemia. As we have earlier discussed it is one of the clinical manifestation of the ischemic heart disease. So it can be defined as the necrosis of the heart muscles resulting from the ischemia. Now coming towards the causes, what are the causes of myocardial infarction? So the first cause is the acute plaque change in the atherosclerosis. Acute plaque change in the atherosclerosis like rupture of the atherosclerotic plaque, ulceration, and this result in the formation of thrombus or thrombosis, and this thrombus in turn completely occlude the coronary arteries, resulting in the stenosis of the coronary arteries and thus ischemia. In contrast to the unstable angina, in which there is incomplete occlusion of the coronary arteries, myocardial infarction में क्या होता है कि complete occlusion होती है coronary arteries, and this result in ischemia and thus the myocardial infarction. The second cause, the most common cause, is the coronary artery vasospasm, and when this vasospasm is for more than 20 minutes, when it is less than 20 minutes, it causes the prismatal angina. The third important cause is the emboli, and this emboli may be from the neural thrombi which is present in the heart, or it may be from the vegetations which are mostly present along the rheumatic valves or other valvular diseases. The fourth important cause is the vasculitis of the coronary artery is occur in the Kawasaki disease. The fifth important cause is the amyloid deposition in the coronary arteries, which cause the stenosis or the damage of the coronary arteries and the ischemia. And the sixth is the blood stasis in the coronary arteries, which cause the ischemia and inability of the coronary artery to supply blood to the myocardium. So these are some causes like the atherosclerosis, vasospasm, embolization, vasculitis, amyloid deposition, and the blood stasis, which these are some important causes which can cause the myocardial infarction. Then now studying towards the pathogenesis, that how this myocardial infarction occurs. So as we have already discussed that acute plaque change like ulceration or erosion of the atherosclerotic plaque will expose the subendothelial collagen and the necrotic plaque contents to the blood. This will, for example, this is the coronary arteries, and this is the atherosclerotic plaques. This is the flow of blood. Now any acute plaque change like ulceration or erosion of this plaque will expose the necrotic contents in the plaque or the subendothelial collagen present in the blood vessels to the blood, and this will in turn cause the platelet aggregation and activation, or it can also cause the coagulation due to the growing thrombus. This exposure to the subendothelial collagen or the necrotic plaque can result in the platelet aggregation and activation, or the coagulation in the blood vessels due to the growing thrombus. These two will play an important role in the completely occlusion of the coronary arteries. They will completely occlude the coronary artery, which in turn will cause ischemia, and thus it will in turn cause the myocardial infarction. तो इसकी कुछ पैथोजेनेसिस होगी ड्यू टू एक्यूट प्लेक चेंज. इसी तरह जो है वेसोस्पाज्म भी क्या करता है, occlude the blood vessels and thus limit the supply or decrease the blood supply to the heart vessels, इस तरह एम्बोलाइजेशन भी ये काम करता है, वस्कुलाइटिस भी, हेमोलाइट डिपोजिशन भी और ब्लड स्टेसिस भी इस्कीमिया काज करता है, उसी तरह मायोकार्डियल इंफार्क्शन काज करता है. Now coming towards the types of MI depending upon the thickness of the valve involves. So as we have already discussed that the myocardial valve consists of three levers: the epicardium, the endocardium, the myocardium, and the endocardium, myocardium in the epicardium. So the blood vessels come through the epicardium through the myocardium and supply the outer part of the epicardium, while the inner part is also supplied directly from the ventricular blood or the cardiac blood. Now we have three types: the subendocardial MI, the transmural MI, and the microscopic MI. The subendocardial MI, it is the initial stage and it is mainly due to the occlusion of the endocardiac vessels. For example, these are the endocardial vessels. So occluding these will cause the subendocardial MI, and on the ECG we can see that there is ST segment depression, and hence it is also known as the non-ST segment elevated MI. In contrast to the subendocardial MI, we have a transmural MI which occurs throughout the wall of the heart, and it is mostly the late stage and mainly due to the severe ischemia, and there is occlusion of the epicardial vessels. So if we occlude these vessels, so it will involve also, it will block the blood to the epicardium, to the myocardium and the endocardium, and thus as a whole there will be a transmural myocardial infarction. And on the ECG we can see that there is ST segment elevation, so hence it is also known as the ST segment elevated MI or the STEMI. The third one is the microscopic infarction, and it is mainly due to the small vessels occlusion, and this may be due to the vasculitis of the small vessels due to the mural thrombi, due to the embolization of the vegetation, or maybe due to the increased catecholamines as occur in the piochrocytoma, which cause the vasospasm of the small vessels, and thus the microscopic infarcts. Also we can see on the ECG that there is no change due to the microscopic infarct. Here we can see the ST segment elevation. I will change the color. This is the ST segment elevation, and there is the ST segment depression. There is the P wave, KRS, and it is the T wave. So there is ST segment elevation, and here we can see the ST segment depression. Now coming towards the location of the MI, at where does this MI occur? So it mainly depends upon the artery involved. For example, there may be anterior valve involvement, there may be lateral valve or posterior valve, or there may be a septal valve involvement, or there may be only the endocardial region involved, or there may be only the microscopic infarcts. So it mainly depends upon the artery involved. So we have two kinds of infarct, transmural and the non-transmural infarct. The first one and the most common is mainly due to the permanent occlusion of the left anterior descending branch. This is the left anterior descending branch of the coronary artery, and it mainly causes infarct in about 40 to 50% of the patients. So it will result in the anterior wall infarcts and the 1/3 or the 2/3 of the septal wall. It will involve the anterior wall of the myocardium or the heart, or the 1/3 or 2/3 of the septal wall. The second most common is due to the permanent occlusion of the posterior descending branch of the right coronary artery, and this is the posterior descending branch of the right coronary artery, and this will cause the infarct in the posterior wall of the heart, and in the 1/3 or 2/3 of the septal wall. It also causes infarction in the pupillary muscles. The third most common is due to the occlusion, permanent occlusion of the left circumflex branch of the coronary artery, and it will cause the infarct in the lateral wall of the heart. Now coming towards the non-transpural infarct, so it may be due to transient or partial obstruction, and this will result in the regional subendocardial infarct. As you can see, is the regional subendocardial infarct. The second one is due to the global hypotension, and this will global hypotension mean that hypotension throughout the body, and this will lead to a circumferential subendocardial infarct. As you can see, and blood supply decreased, and it will cause the circumferential subendocardial infarct. And the second one is the microscopic infarcts, mostly due to the small intramural vessels and occlusions, and it will lead to the micro infarcts or the microscopic infarcts. So these are the some types of the myocardial infarction on the basis of the location, and it mainly depends upon the artery involved, as we have already discussed.